Now, this is the types of staff used to deliver vaccine, and this is in the public health or community health setting clinics only. So this is the public provision of vaccine through the typical normal, I shouldn't say normal, but the public health clinics. And public health was actually in the provinces given the vaccine to distribute to through the usual patterns. So you can see that if you look at this, the first 6 choices actually that are presented in this graph are actually RNs. Now that might provide food for thought, and we will be reporting this out to all operations, but we obviously are relying a tremendous amount on registered nurses as delivering vaccine. Might be good, might be bad, I don't know. But that is our, by far and away, the healthcare profession that delivers vaccine in Canada. As we go across this graph, you can see that the usual staff was obviously not very commonly chose, and by usual staff we mean limiting it to usual staff. Retired nurses were used frequently. The most frequently reported strategy to get more staff is very challenging for the healthcare system, given that there would also be more demand for services in the healthcare system at the same time. And that was deploying acute care nurses and mental health nurses into public health to deliver vaccine. Student nurses were reported frequently, moderately. Use of casual nurses and external nursing agencies. The last smaller little wedges are other types of personnel, including physicians or residents, and community home care and long-term care, then pharmacists, paramedics, and LPNs. LPNs, interesting enough, were very seldomly reported being used, which is kind of interesting to me. The northern residents reported the use of internal staff, and their other option was to use our nurses from acute care, some retired and unemployed. The Atlanta group most often reported the use of RNs from various sources: unemployed, retired, casual, and some positions. The Ontario respondents were the ones that reported using nursing agencies for extra staff, and they did not redeploy RNs from other sectors of the healthcare system. I think that can be explained, and again, people from Ontario can correct me, but in Ontario, public health is still typically outside the mainstream, or not integrated into the healthcare regions, for lack of a better way of explaining it. So they would have probably less easy access to the nurses in acute care. And the Western group reported the most frequent use of pharmacists. And again, at your leisure, more detailed data. Looking at the same question, i.e., how did you get the staff to work in your public health clinics? And being cut by rural versus or urban versus rural remote, you can see that in the rural remote areas, there was a more frequent reporting of just counting on their own public health staff, community health staff, and external agency RNs, as well as physicians, community home care, long-term care, and LPNs, interesting enough. In the urban areas, there was much more frequently, relatively more frequently, report of redeploying acute care nurses and mental health nurses, as well as use of paramedics. So the urban areas reported relatively more use of student nurses, and again, that's probably because in the urban areas, that's where the student nurses actually are when they're students. The rural remote areas, I've already mentioned this. And here's again the data to mull over.